as quick as that. And I'm booked in, bring my bag, I'm in my bed, I've got no worries, and that's an important thing.
It's our chronic conditions patients who are really the ones who use our health system the most, and anything we can do to try and improve their stays is beneficial.
West Moreton's one of the fastest growing regions in the state, and we've needed to find efficiencies within the system to be able to provide healthcare to our community.
Prior to seeing us, Ian had mentioned to us that his previous stays in hospital had been up to 3 to 4 days to do the same thing, and now we're getting him home within 8 hours.
Coming in and being able to go home on the same day is incredible. From the week's wait beforehand that I had, and a whole week difference to me and my family is obviously amazing, because time at home is spent better because I have more time with them. Always a good thing.
The main goal of our MAPU is to get patients out of the emergency department faster.
And that just means that medical patients are being looked after on medical wards so that the emergency department can look after patients with emergencies. So it's getting patients to the right place and being looked after by the right people in the right setting.
On average, our patients spend 4 hours less when compared to what they were spending in the emergency department prior to our service starting.
So to save time is such a crucial thing. Time is the one thing I haven't really got, and this has taken days off waiting times.
Ian was one of the first patients we saw through our MAPU. He'd recently been diagnosed with stomach cancer, and as a result of his cancer, he accumulates fluid in his belly called ascites, which can be really uncomfortable for Ian.
Instant relief. As soon as the drain goes in, for the first 10 minutes of being in this ward is instant relief.
At the same time as we were setting up our MAPU, we were lucky enough to have funding for a rapid access clinic. And the rapid access clinic allows us a place to bring patients into hospital who need to see a specialist and get that multidisciplinary specialist care, but might not necessarily be unwell enough to need to go through the emergency department. Linking those two in together, we're able to get Ian into the rapid access clinic, perform blood tests, work out whether or not he needs to have the procedure performed, and then get him admitted to the MAPU to have the fluid drained. It turns what used to be a 3-day admission into 8-hour admission with him home the same day to his family.
The biggest difference between MAPU and the other medical teams is that we have a dedicated multidisciplinary team.
The physios, the occupational therapists, the speech pathologists, the dietitians all work together within MAPU to try and get that patient home sooner and provide them the best holistic care we possibly can under the supervision of the medical team.
I'm in and out of here quick, pain-free when I leave, which is always good.
Having the same allied health staff looking after your group of patients really improves the care. We have multidisciplinary team meetings every day. Because we're all on the same ward, we're able to have chats in between seeing patients too, and it's just better patient care.